Hello, and welcome to In Touch Safety, a workplace health and safety webinar series presented by Encompass, Michigan. Today's topic is effective safety and health programs. My name is Todd Culver. I'm the president and CEO of Encompass, Michigan, which is a statewide network of comprehensive human service providers working together to develop independence and achieve inclusive communities. It's my privilege to be your presenter on this topic, and it's great to be with you today. In Touch Safety is a training project established in partnership with the Michigan Occupational Safety and Health Administration, or MIOSHA's SET division, the Consultation Education and Training division. And this material was prepared under a SET grant awarded by MIOSHA. MIOSHA is part of the Department of Labor and Economic Opportunity, or LEO, and Encompass, Michigan has a long-standing and highly valued partnership with MIOSHA. What we'll cover today is a series of recommended practices from federal OSHA, the Occupational Safety and Health Administration, for safety and health programs. And it will present really a step-by-step approach to implementing this type of program, built around 7 core elements. The main goal of safety and health programs is to prevent workplace injuries, as well as illnesses and deaths, and the suffering and financial hardship that these events can cause, not just for workers, but for their families and for employers as well. OSHA's approach to effective safety programs is that a safe workplace is sound business, and Encompass, Michigan supports that approach. These recommended practices take a proactive approach to managing workplace safety and health. Sometimes more traditional approaches are reactive in nature. That is, problems are addressed only after a worker is injured or becomes ill, or after a new standard or regulation is published, or even after an outside inspection finds a problem that needs to be addressed. These recommended practices instead recognize that finding and fixing hazards before they cause injury or illness is a far more effective approach. The most rigorous preventive safety program takes the view that there is always something about an incident leading to injury that could have been different. Accidents don't just happen. There are circumstances that we can manage that lead to a more effective preventive environment. And it's incumbent upon us to continuously assess the landscape, to identify the potential for a problem and fix it before one occurs. That's what this presentation is all about. That's the approach that's taken by Encompass, Michigan, as we attempt to support our members in building effective safety and health programs. And it's OSHA's approach in developing these 7 core elements that will hopefully provide a framework for effective safety programs that promote prevention in your organization as well. The recommended practices that OSHA puts forward are management leadership, worker participation, hazard identification and assessment, hazard prevention and control, education and training, program evaluation and improvement, and communication and coordination. We'll look at each of these recommended practices, each of these core elements separately and individually. The first is management leadership, and management provides the leadership, the vision really, as well as resources needed to implement an effective safety and health program. This type of leadership means that business owners, managers, and supervisors make worker safety and health a core organizational value. They're fully committed to eliminating hazards, to protecting workers, and continuously improving workplace safety and health. They provide sufficient resources to implement and maintain the safety and health program, and visibly demonstrate as well as communicate their safety and health commitment to workers and others. And quite often that's done by setting an example through their own actions. Worker participation is required for any safety and health program to be effective, and meaningful participation of workers and their representatives should be involved. Workers have much to gain from a successful program and the most to lose if the program fails. They also know the most about potential hazards associated with their jobs, and successful programs tap into this knowledge base of the people who are doing the work. Worker participation means that workers are involved in establishing, operating, evaluating, and improving the safety and health program, and that all workers at a work site should participate, including those employed by contractors, subcontractors, and temporary staffing agencies. And it's in this last area that one of the other core elements, communication and collaboration, becomes increasingly important. In an effective safety and health program, all workers are encouraged to participate in the program and feel comfortable providing input, as well as reporting safety or health concerns. They have access to information they need to participate effectively. They have opportunities to participate in all phases of program, both in its design and implementation, and do not experience retaliation when they raise safety and health concerns or report an injury or illness or even a hazard for participating in the program or exercising their health and safety rights. The next core element is hazard identification and assessment. And one of the root causes of workplace injuries, illnesses, and incidents is the failure to identify or recognize hazards that are present or that could have been anticipated. This is part of what I meant by there's always something about the conditions leading to an incident or injury that could have been different. And a critical element of any effective safety and health program is a proactive, ongoing process to identify and assess such hazards. To identify and assess hazards, employers and workers should collect and review information about the hazards present or likely to be present in the workplace, and conduct initial and periodic workplace inspections of the workplace to identify new or recurring hazards. Also, a part of this core element is investigation of injuries, illnesses, incidents, and close calls or near misses to determine the underlying hazards, their causes, and safety and health program shortcomings that may have contributed. We should group similar incidents together and identify trends in injuries, illnesses, and hazards reported, and consider hazards associated with emergency or non-routine situations. Another helpful lens to view this through is determining the severity and likelihood of incidents that could result for each hazard identified, and use this information to prioritize corrective actions. Some hazards, such as housekeeping and tripping hazards, can and should be fixed as they are found. Fixing hazards on the spot emphasizes the importance of safety and health and takes advantage of a safety leadership opportunity. And there are resources available through the OSHA website, osha.gov, to allow you to learn more about fixing other hazards identified using the processes described here. It also leads to the next element of a successful and effective safety and health program, which is hazard prevention and control. Effective controls protect workers from workplace hazards, help avoid injuries, illnesses, and incidents, and minimize or eliminate safety and health risks. And it really helps employers provide workers with safe and healthful working conditions. The process described in this section under this core element will help employers prevent and control hazards, some of which we addressed in that previous section. To effectively control and prevent hazards, employers should involve workers who often have the best understanding of the conditions that create hazards and insights into how they can be controlled, identify and evaluate options for controlling hazards using a hierarchy of controls, Use a hazard control plan to guide the selection and implementation of controls and implement controls according to the plan. Develop plans with measures to protect workers during emergencies and non-routine activities, and evaluate the effectiveness of existing controls to determine whether they continue to provide protection or whether different controls may be more effective. It's also important to review new technologies for their potential to be more protective, more reliable, or even less costly. Education and training are also important tools for informing workers and managers about workplace hazards and controls so they can work more safely and be more productive. Another role is to provide workers and managers with a greater understanding of the safety and health program itself so that they can contribute to its development and implementation. Education and training provides employers, managers, supervisors, and workers with knowledge and skills needed to do their work safely and avoid creating hazards that could place themselves or others at risk. It can provide awareness and understanding of workplace hazards and how to identify, report, and control them, and specialized training when their work involves unique hazards. Access to education and training materials through Encompass Michigan and our partnership with the MIOSHA Consultation Education and Training Division is available to all who are viewing this webinar. And we encourage you to explore those resources through our website. The next core element is program evaluation and improvement. And once a safety and health program is established, it should be evaluated initially to verify that it is being implemented as intended. But employers should also annually assess what is working and what's not, and whether the program is on track to achieve its goals. Sharing the results of monitoring and evaluation within the workplace and celebrating successes will help drive further improvement. Program evaluation and improvement includes establishing, reporting, and tracking goals and targets that indicate whether the program is making progress. It's important to have metrics that measure success. What is it that we're trying to achieve, and are we making progress towards that goal? Whether it's elimination of hazards, reduction in the frequency of injuries, or even more targeted and specific, such as a reduction in the number of a specific type of injury, such as a back injury or a repetitive strain. The program should be evaluated both initially and periodically thereafter to identify shortcomings and opportunities for improvement. And evaluation and improvement also includes providing ways for workers to participate again in this program evaluation, as well as its improvement if necessary. And the last core element is communication and coordination. And in the current labor market, it's no surprise that an increasing number of workers are assigned by community rehabilitation organizations or CROs or staffing agencies to work at specific host work sites under the direction and control of the host employer. In these situations, it's important for the CRO or staffing agency and the host employer to communicate and coordinate to provide and maintain a safe work environment for their workers. Safety is enhanced if employers coordinate their efforts and communicate effectively to afford all workers equal protection against hazards. Failure to take these steps may undermine safety programs. For example, if the different employers have inconsistent policies for when and where to wear personal protective equipment, workers may mistakenly believe that the equipment is not needed, and that could lead to injury. Inconsistent safety policies may also cause workers to question the credibility of safety and health programs, resulting in less meaningful employee engagement and participation, which is key. Effective communication and coordination among such employers means that before coming on site, community rehab organizations and staffing agencies and their workers are aware of the types of hazards that may be present, the procedures or measures they need to use to avoid or control their exposure to these hazards, the appropriate contact, whether it's host employer, CRO, or staffing agency, to report an injury, illness, or incident if they have a safety concern, and what to do in case of an emergency. Working together to make these patterns and these routes of communication clear is critical to success in this type of labor arrangement. In closing, health and safety program benefits include helping businesses to prevent workplace injuries and illnesses, improve compliance with laws and regulations, reduce costs, including significant reductions in workers' compensation premiums, engage workers, enhance their social responsibility goals, and increase productivity and enhance overall business operations. Thank you for taking time out of your busy days to tune into this webinar. Encompass Michigan aspires to be a trusted resource for getting connected and staying informed, including in the health and safety arena. We very much value our partnership with the MIOSHA SET division. And again, remind you that In Touch Safety is a training project in partnership with MIOSHA SET division, and that this material was prepared under a SET grant. Thank you again for tuning in, and be careful out there.